Hello, my name is Roisin Doherty and I'm a Delivery Director for eHealth in the HSE. eHealth is the division and team of people who are responsible for delivering the technical solutions that support our health services. We are absolutely delighted to have been shortlisted by the PMI for the Greatest National Impact Award for the technical solutions that we delivered to protect and help our nation in defending ourselves from the COVID pandemic. There is no one among us who did not at some point benefit from the technology that we delivered. You might ask why technology was so important. You will probably remember well in the early days our hunger for numbers. How many positive cases? How many in my area? None of this would have been available without technology, which was the only way we could quickly and accurately capture the critical information needed to track COVID and plan for what was needed to protect ourselves and the vulnerable among us. Chances are you personally would have been helped by our technology, whether it was for getting a COVID test appointment, a vaccination, or even an electronic prescription sent from your GP to your local pharmacy. All of this was made possible because of the technology that eHealth put in place. For those of you who were fortunate enough to escape COVID, you too would have benefited from the protection of public health measures that were informed by the data captured in our systems. Just think of your mobile phone. If you were referred for a COVID test by your GP, you would have received an SMS message with your appointment and your test results usually within 24 hours. If you tested positive, you'd have been contacted on your mobile phone by our contact tracing team. Many of you may have also used our COVID tracker app. And if you were vaccinated, you probably registered for your vaccine appointment on our website portal, got an SMS text message with your appointment details, and then got your COVID digital certificate, which you could also store in your COVID tracking app. I'm just going to show you a short video from early on in the pandemic about COVID testing and contact tracing. The technology supporting this is not visible, but see if you can spot where the technology was needed. In particular, take note of the amount of times a mobile phone is used, as behind every communication to your mobile phone, there is at least one technical system required.
If you think you have symptoms of COVID-19, you must self-isolate to protect others. Call your GP for a free test referral, or if it's the evening or weekends, the GP out of hours service. You'll get your appointment by text message from the HSE. The test is free too. Testing is quick and safe, with the swab test taking only 15 seconds. The swabber will be wearing PPE and will take a swab from the inside of your nose and throat. The swabs are labelled, packed and delivered to one of our laboratories. Here the swabs are put onto the laboratory system for testing. There are a number of steps in the testing process, so it can take up to 24 hours to see if the virus is present in your sample. The result is sent by text message within 48 hours of your test appointment. If you have COVID-19, our contact tracing team will phone you and start to trace anyone you have been in contact with. We will ask them to stay at home. This is because we want to make sure they don't pass COVID-19 on to others. Most people who have COVID-19 will recover at home with rest and care. Thank you to the more than 1 million people who have come forward for testing and their contacts who have stayed at home. Thanks to our staff and to you for playing your part in helping keep everyone safe. Visit hse.ie for more information.
So, if you spotted correctly, there were actually 4 different technical systems involved here. And just to give you an idea of the volume of electronic communications that these systems were handling, 18 million test appointments were made, 9.1 of them referred by GPs. 18 million test results were sent, and 2.5 million were contacted on their mobile phones by contact tracing. And that's just COVID testing. Then COVID vaccinations came along, and eHealth stood up the system to support the vaccination programme within 3 weeks. An absolutely phenomenal achievement. In addition, we set up systems to allow you to get your vaccine from your GP or in your local pharmacy. And the system now holds over 10.8 million records for vaccinations and boosters. Speaking of vaccinations, may I take this opportunity to extend my congratulations to our colleagues within the HSE vaccination programme, who have also been shortlisted for this award. It has been an absolute privilege to work hand in hand with such a dedicated, driven team who worked relentlessly on the HSE's mission to ensure that everyone who wanted a vaccine was able to get it. Remember also that while you personally may have had direct contact with testing and vaccination systems, these same systems were the ones used for the vulnerable among us, those that were housebound or in residential care facilities, such as in nursing homes. Less obvious, but equally as important, was the need to put systems in to reduce the risk of COVID spreading, to protect the vulnerable among us and the health workers caring for them. Examples of these systems would include telehealth solutions, which allow clinicians to consult remotely with their patients, and other technologies such as electronic prescribing, which reduce the need for patients to visit their GP practice or pharmacy to get their prescriptions. For our health workers, we even put a system in place to allow them to book accommodation for themselves if they needed to isolate to protect their families. I mentioned earlier the hunger we all had for numbers. While this was important to each of us personally from a curiosity point of view, that information was absolutely crucial for public health to track the disease, for the government to see the scale and spread of the disease, and to inform the decisions that needed to be made in relation to lockdowns, etc. Furthermore, it allowed the HSE to identify where the demand was high for testing or vaccination, so they could secure the supplies needed of test kits and vaccines. And furthermore, figure out the best locations to put vaccination and test facilities closest to where the highest demand lay. Which reminds me now to also mention the eHealth team, who rapidly deployed over 9,000 laptops and tablets to the test and vaccination centres, and in some cases to mobile centres in locations such as GAA grounds. They had to ensure that these centres could securely connect with our networks and were up and running 7 days a week. Note that this was also happening at a time when this same team were trying to equip 125,000 of our workers to work from home. Quite often, the only time people are aware of how dependent we are on technology is when it doesn't work. While it has been a very challenging 3 years now for our eHealth, it has been so rewarding for us to have had the opportunity to demonstrate what technology can do when it does work, and how we can transform the way our health workers can efficiently deliver health services. We are all so proud of our eHealth team, their expertise, their innovation, drive and sheer commitment, which they used to answer the call to action to defend everyone from COVID. While all that we have done has made an impact for our colleagues in the HSE, the wider public service, our clinicians, our frontline workers, and indeed the wider population of Ireland. On a personal level, I have always had a great sense of pride when I hear a member of my family or friends say, I booked myself for a COVID test or a vaccine, or I got my vaccination certificate. I smile and think, we made all that possible. So with all that in mind, may I ask you now to think about how you or your loved ones may have been touched in your daily life by what we have done. Whether you booked a COVID test or an antigen test kit, got a vaccination, or even just had that digital cert that allowed you to sit down with your friends in a restaurant. If so, please give the HSE eHealth team your vote. It is your opportunity to send a thank you to our silent heroes in HSE eHealth. On behalf of my colleagues in the HSE eHealth, may I thank you for taking the time to listen to this presentation. We look forward to building on what we have done here for COVID to further transform the delivery of health services for all in the future. Thank you.